Welcome to everybody who joined us today. I'm just introduce myself and some of the people I'm here with. I'm Pam Browell, and I'm the nursing director for cardiac intermediate care in the cardiac ICU here at Beth Israel Deaconess Medical Center. And I'm joined by Sarah Wasserman, who's assistant nursing director on FAR 3, and Andrea Milano, who's a nurse specialist who works with me in both these areas. And we're wanting to talk with you about opportunities for growth and discuss our new inpatient building and have an opportunity to answer any questions that you may have regarding opportunities for nursing careers here in these areas. So Beth Israel Deaconess Medical Center is part of the BIDMC network, and we are a level 1 trauma center with just under 700 beds here in Boston. And the cardiovascular medicine department is one of a really dynamic and growing part of Beth Israel, where we are going to be launching a new heart transplant program set to be opening in 2023. That program will kind of provide all services to our patient population and will really kind of be a comprehensive center for our network. So we're excited for that, and that'll definitely impact our cardiology department as well. And so this is a short video with some nurses from our different areas talking about what it's like to work here at Beth Israel.
I think the people that I work with are the best thing about my job. I feel every day I come in, I feel like I'm working with friends.
I always knew I wanted to work at BIDMC, so I applied, and I've been very happy with the change and you know, what has brought my career.
I just like that there's always opportunity for me to grow, and I really appreciate that.
We try to do things outside of work that, you know, allows us to connect as well, and, you know, just let our hair down and be more comfortable with each other.
Here at BIDMC, nurses across the board, whether they're female or male, are treated equally. We all share the same desire to care for our patients at the same level. It's, in my opinion, a wonderful place to work.
I'm going to hand it over to Sarah, and she's going to talk about the FAR 3 patient population.
Hi, everybody. I'm Sarah, and again, I'm the Assistant Nursing Director of FAR 3, which is the intermediate cardiology unit. It is a 32-bed unit, and our primary patient population consists of advanced heart failure. Everyone's hospital stay looks a little bit different depending on the etiology of their heart failure, but the average length of stay is between 5 to 7 days. Some of these patients are just here being diuresed and getting goal-directed medical therapy, while others require more advanced therapies, such as inotropic therapy or pulmonary arterial lines, as well as LVADs. We're the designated non-ICU area for LVAD patients to be admitted to. So whether they're coming into the hospital with a cardiology admission, or they're just here for something else that's going on, like a cellulitis, they'll be admitted to the FAR 3 unit. Other patient populations that we see is just a general cardiology mix. That's like our acute coronary syndrome, NSTEMIs, STEMIs, electrophysiology patients that are having pacemakers done, ablations, other EP procedures. We also have a big structural program at BIDMC. So we do see patients that have had TAVRs, MitraClips, TriClips, patients here with arrhythmias that need IV antiarrhythmic medications such as lidocaine or amiodarone, patients with pericardial drains, and we also have a pulmonary hypertension patient population that requires IV vasoactive medications such as Velitri or Remodulin. Our nursing ratios are 1 to 3 for the step-down patients during the day and evening, and 1 to 4 for our general cardiology population. And that's between the hours of 7 a.m. and 11 p.m. Overnight, the ratios go up a little bit. So we have 1 to 4 for an intermediate care assignment and 1 to 5 for a general patient assignment.
Great, thanks, Sarah. And for the CCU, it's the Cardiology Medical Intensive Care Unit, and we are an 8-bed unit currently. When we move to the new inpatient building, which will be in the beginning of March of 2023, so coming very soon, we'll be expanding to a 15-bed unit, and that's in anticipation of kind of growing our outside hospital transfers and referrals, and increasing our capability to care for mechanical circulatory support patients, as we anticipate that will increase with our transplant program. So the case mix is, similar to what Sarah was talking about, but the acute coronary syndromes, patients with arrhythmias, cardiogenic shock, patients post cardiac arrest, we see procedural patients. But our biggest technology, in addition to the ICU kind of modalities with CRT and vents and invasive monitoring, is the mechanical circulatory support patients that we see. So we see intra-aortic balloon pumps, Impella, a couple of different kinds of Impella, Protect Duo, Centromag, and VA ECMO. We also see left ventricular assist device. Those patients are established LVAD patients who have ICU needs, such as infection, failure, bleeding complications, things like that. So we do care for those patients in the CCU. All of our ratios are either 1-1 or 1-2 around the clock in the CCU. And then the culture, both units are just very fast paced. There's always a lot to learn in cardiology, and lots of opportunities to grow your practice. As our nurses join our units, there's a kind of standard patient population, and then we make sure that they're have that practice at a standard, and then we advance to the more complex patient populations. So there's lots of classes during the first year, and then ongoing annual competencies. It's a very supportive working environment. We have unit-based educators, resource nurses who are very hands-on and supportive, and then our leadership team, as well as our education team, are very involved in helping on the day-to-day stuff. And then we work really very closely with the heart failure team, particularly on FAR3, but also in the CCU with our most complex patients, such as the VA ECMO patients, are managed on the heart failure team. And then FAR3 itself has been a great foundation for staff who want to have a career in the ICU, get a lot of exposure to some very key practices there, learning them all in a less intense environment. And then next we have this video. This is from a couple of FAR3 nurses who joined our unit within the last year or so, talking about their experience.
Coming into the hospital as not a new grad, as someone who has already been a nurse for a little over a year, I wasn't expecting the kind of support that I got.
We have a really good dynamic on the floor, I think, when it comes to having a lot of leadership. Our unit-based educator worked as a floor nurse on our floor for many years before taking that role. She is definitely a huge asset to our unit education.
It's been an incredibly positive experience so far. As I said, I felt supported throughout my orientation and continuing. I really look forward to becoming step-down trained and taking some of the more higher acuity patients on the floor. I'm not nervous for it because I know that the support that I've had over the past 5 months will just continue through that. So if anything, I'm really excited for the challenge.
I had a similarly fast-paced environment over at the rehab I worked at, but there's a certain point where you've reached all you can learn, and it's time to move on to the next challenge, and Beth Israel Deaconess was definitely the place to go for that.
Great. All right, and then Sarah's going to talk about our heart failure team.
So this is the heart failure clinicians that we work with. They're a group of attending cardiologists with a specialization in heart failure management. And they're a really fun and great group to work with. We collaborate very closely as nurses with this team, not only on developing individual patient care plans, but also guiding the nursing practice and bringing the best evidence-based practice to the care that we give these patients. And we've built very supporting and trusting relationships with this group of clinicians.
And this is a drawing and rendering this building, the new inpatient building. The first new inpatient building in over 30 years at Beth Israel is underway. It's really coming together and will be ready for occupancy later this year, and we'll be moving into the building in early 2023. So that's exciting time to be joining our team and expanding our patient populations to include heart transplant here. This is going to be, state of the art kind of space with some rooftop garden that will be accessible to our staff as well as to our patients and their families. So we're really looking forward to moving into that new building in less than a year. It's hard to believe. And then this is my contact information. If there's, feel free to reach out to me at any time, and I'd be happy to talk with anybody if there's any questions now that you'd like to bring forward. Susan, you have a question?
Yes. What is orientation like? Or how long is it roughly?
Great.
Hey, Susan, I can take that question. My name is Andrea Milano, and I'm the nurse specialist for FAR 3 and CCU. On our intermediate care unit, staff will receive an 8 to 10 week orientation, which will include centralized orientation classes that encompasses 2 days of nursing orientation, intro to telemetry, and a review of our electronic medical documentation system. They will also work with dedicated preceptors as well as attend our unit-specific classes to help prepare for managing our cardiology patient population. After 4 to 6 months off orientation, that's when they'll be introduced to our intermediate care patients, which is an 8-hour day class that includes reviewing vasoactive medications, antiarrhythmics, pericardial drains, and ventricular assist devices. For CCU, it's a little bit longer. It ultimately encompasses 12 weeks, and nurses will attend critical care orientation through the Boston Consortium, which is a week-long workshop with other Boston new critical care nurses in the area. And then they'll take unit-specific classes to review various mechanical circulatory support devices and patient-specific populations.
Thank you.
Can you describe opportunities for professional development?
I'll take this one. I think professional development has always been a large priority in the nursing culture at BIDMC, but especially since we've started this journey to Magnet, there has become lots more opportunities for professional development. Some of these include the RISA program that was developed, and that stands for Recognizing Excellence, Scholarship, and Accountability in Nursing. And that is a fellowship that nurses can apply for if they meet certain criteria. It's a point-based system, and you earn points by doing different projects on your unit, maybe a quality project, or by participating in different work groups. And once you complete your portfolio, you can apply. They accept applications 2 times a year. And if your application is accepted, you will earn the title of Nurse Fellow or Senior Nurse Fellow. And it includes a monetary bonus that you get for that too. Other opportunities for professional development include unit-based counsel, and there's opportunities to attend those meetings even if you're not holding a seat on the council, but we do elect new members every year for the unit-based council, so that's a great way to get involved. And there's also opportunities to serve on the central councils if you are involved on the unit-based council. Certification is a big thing right now that we're encouraging for nurses, and there's opportunity to get reimbursed for any professional certification using the tuition reimbursement benefit.
If we're interested in applying, what would be our next steps? Could we email you, Pam?
Yeah, that's totally fine. I'm happy to share with them the process for application. We have a portal page. I know it can be sometimes a little challenging to navigate, so I'm happy to share specific rec numbers that might kind of make it a little bit easier, but the process really would be, have an application and get screened by HR, and then have an appointment with myself and Sarah as well, if it's a Part 3 position, and then have an interview. We often also provide an opportunity to shadow on our unit. I think it's a great opportunity to see the patient population and get a sense of the unit dynamic, to make sure it's a good fit. So we like to offer that opportunity as well.
Thanks.
Sure.
Maybe you could talk about the qualities that make for a successful candidate.
Sure, yeah, I'll take that one. I like to always say that there's so much to learn in cardiology. It's just a really vast kind of clinical patient population, and we provide a lot of classes, but the most successful candidate is really pretty self-motivated as well, takes opportunities, whether during their shift or in their own time, to kind of review what's already been presented in classes, or kind of research a bit more what the clinical situations that they were exposed to during their shift, to kind of inform and broaden their understanding of their the patient's diagnosis or testing or treatment plan. It helps them to really develop their clinical practice in a much more purposeful way when you're actively engaged as a learner. So I think that those qualities serve people well, asking questions, looking at policies, but just being an active learner, I think, is the best advice I can give on joining any of these units.
Not sure if it's an easy description, but maybe Sarah, could you describe how long you've been at BIDMC and what your background is?
Sure. Yes, I came to BIDMC in 2017 with just 1 year of nursing experience under my belt. So I've been here for over 5 years now. I got my BSN from Keene State College, and my first job that I held as a nurse was on a cardiology unit at a small community hospital. When I made the transition to Beth Israel, I felt the same support that was talked about in those videos. I had never worked in an academic medical center before. I didn't have any experience as a student in an academic medical center. So it was a big learning curve to understand how to care for patients in this new environment. I would say it took about a year to feel comfortable. And after I got comfortable with the intermediate care patients, I started orienting new hires and working in the off-shift resource role, and then becoming kind of a primary resource nurse on the unit. And then after that, I kind of grew an interest in leadership, and I enrolled in a master's program for nursing administration. So I'm currently completing that, and I was in the clinical advisor role for about a year, and with so much change on the unit, it became available that I could take the assistant nursing director position. So that's kind of how I've landed myself here.
Thank you for doing this. It was really helpful.
I see Kathleen just took herself off mute.
Yeah, sorry. I was trying to raise my hand or ask a question.
Absolutely, go right ahead.
Is it typical to start in the kind of like general patient role or nurse role on the FAR 3 and then advance after the 4 to 6 months to the kind of step down patients and then advance to the CCU, or are there positions available to start right in the CCU level?
Yeah, that's a great question. It depends on people's interest. I think that depending on the background and their interest in critical care, you can go, with, I would say 1.5 to 2 years of experience in a med-surg area, you could go straight to the CCU if that was a particular drive that a person had to go straight to critical care. It's a lot, I would say, if you don't have a strong cardiology background, but it's doable. You're learning cardiology and critical care at the same time, and that can be a lot. FAR 3, I think, is a great transition to the CCU because you learn so much about inotropes and PA lines in a less demanding setting. And it really helps the transition. We've had a number of nurses start on our unit on FAR 3, I should say, after coming with a year or so experience, just as Sarah said, and then spend 1.5 to 2 years on FAR 3, really building that practice and successfully transitioning to the CCU. It's, I think it's a less stressful learning curve to do it that way, but it all, it's sort of, people have different goals and aims in mind, and we can support that. But we always like to talk through the opportunities, but what's your background, Kathleen?
I've been a nurse for over 20 years, and my background is in med-surg and then telemetry for the past, I would say, 10 years.
Gotcha. Yeah. Yeah, no, it's not required to go through that, to go through FAR 3 to get to CCU. We have hired new nurses to CCU who have come from outside the hospital with, like I said, around 2 years of experience in general, or longer, but sort of a minimum. It's really important that they have sort of assessment skills and time management and communication skills in good standing before they're into the critical care areas.
Thank you.
Absolutely. Well, so then I guess we can conclude our session here if there's no other questions. Thank you for everybody for joining us today, and I encourage you to reach out to me via email with further questions, and I'm happy to speak with you further offline.
Thank you.
All right,
Thank you.
Thank you, everybody.
All right.